Awesome. Well, thank you for having me. My name is Melaney Grenz, and I'm a speech pathologist. I was a speech pathologist in Oregon Public Schools for 29 years, and then 2 years ago, I became the project manager at the Center on Brain Injury Research and Training, and love my job. So a little bit about me. I was born and raised in the province of Saskatchewan, right north of you all. I did my undergraduate work at Minot State in North Dakota. I got a degree in elementary ed, deaf ed, double major. And then I majored in speech pathology. And then I came to the U of O, University of Oregon, for my master's in speech pathology and meant to get back home to Saskatchewan or North Dakota, but then ended up staying here and love Oregon. But gosh, my heart sure is in North Dakota in the Midwest, and wish I lived closer to my parents. So, um, like I said, I would love to have you put your questions in the chat. I know I'm speaking to a very diverse group. I've got quite a few slides. I know that North Dakota is doing some amazing things in terms of getting a toolkit in place, as we are. We've got House bills passing. A lot of good things are going on in this crazy world right now. So, every day I wake up and look for that joy because we're in this for kids, right? Kids and adults, and the people that we serve need us to be on our A game, which is why I come to work every day. So, okay, everyone. So, a little bit about the Center on Brain Injury Research and Training. It was established in 1993. We pride ourselves on promising and evidence-based practices for students with traumatic brain injury, and we conduct loads of research and training. I'm going to speak to a couple of research projects that we have in the works today. So, seminar objectives. You will get a copy of my slides. In the chat, if we could just go for maybe 3 minutes, what is one area about brain injury that you feel you're needing more support with today? Can you just blast it into the chat? I'm just curious. And when I do this live, I give out coffee cards for people that are brave enough to um, state what they would like to learn more about. Anything.
I know for us, and I think Oregon has some spots too that are very rural. How do we support our rural folks? I think
Oh,
that's
yeah.
a big one for
Uh-huh.
North Dakota.
Oh, we have rural areas in Oregon too as well. I was
Mm.
just in an area where it was called Bureau of Land Management, man, and there were wild horses running wild, and I had never seen that before. I'd never been to
Oh,
that part of Oregon. That was a couple of months ago. Oh,
well,
more interventions to help with EF delays for students with TBI. Melinda, are you a speech path? That communication piece, yeah. Yeah, okay. Continued supports in the community. Yep, school psych, okay. Yeah, that executive functioning, that is the buzz. And I'm going to talk about a free webinar that we're going to have in September. Available resources, right, for preschoolers. Okay,
mm,
thank you, Kim. We're going to speak to that. I'm going to write that down. That is going to be one of our major goals in the next academic year is that early intervention, early childhood special ed. What do we do with those kids? How do we test? What are our procedures? So, okay, lovely. Good, good, good. That EF, that's executive functioning, that's a biggie. That's a biggie. Oh, I could spend a couple of days on that, Carrie. Okay. Um, I know that when I first started in this business, and I got my first student with a brain injury, I thought, this isn't a speech path in a school's job. This is the medical realm. But you know what? We're all in this together and it's a team and there's no I in team. And so I just want to encourage you to get to know the medical professionals in your community, become friends with them, and just really collaborate. Everybody keep talking because together we're better. So at the University of Oregon, I just want you to know that I come from a very humble perspective, being a good Midwestern girl. We're not perfect, and our data shows it, and we've got some work to do. So we did all of these studies in Oregon in schools. So 2012, 75% of teachers had never received training on TBI. And guess what? The Center on Brain Injury Research and Training is housed on the U of O campus. That's scary. 2015, children with TBI are underidentified because there's a lack of educator awareness of TBI as a disability. 2016, 75% of teachers have had no training in TBI. You see this resounding theme, and it's not a good theme. 2018, 73% of school psychologists did not feel comfortable serving as a case manager for a student with a TBI. Ouch. Okay. And 2023, three themes emerged from a study that we did. There was a lack of student tracking year to year of TBIs or mild concussions, mild TBIs, otherwise known as concussions. There was a lack of educator training and conflicting views between educators and parents about students' needs. These factors ultimately led to parent frustration and eventually conflict and deteriorating relationships between parents and educators. And over the last 29 years, I've been in some real yucky meetings with parents and teachers. And, education is the key. So we continue to work on increasing this data so that it looks better. I had a meeting last year with the Dean of Education at a university that shall remain unnamed, and it wasn't in North Dakota. And I said, can I please come and speak to any of your classes? And this Dean of Education said to me, we don't have time for that. We're working on other more pressing things. That's the problem. That's the problem. Okay, we need to make time. So I was just chatting with a colleague the other day, and I said, those autism evals were so challenging and so much work, and they had changed so much, and it was just kind of frustrating for me. But it's like, you know what? That's my job, and I needed to do it what's best for kids. So here we go, right? So sometimes folks have told me in the past that they don't have any TBIs. There's no brain injuries in our state. And it's like, well, here's our nationwide data. There's 2,685 deaths per year nationwide, secondary to a brain injury, 62,000 hospitalizations, 435,000 ED visits, accounting for only over 90% of all emergency department visits in children 0 to 14. We know those kids are out there. And I didn't mention earlier in my intro, I oversee all of the traumatic brain injury school teams in Oregon, and I'm also the state of Texas school liaison. So I work a lot with schools, but I also work a lot in the research realm, and I'm working very hard to bring together our medical communities and our school communities in Texas and Oregon. So when we're talking IEPs, individualized education plans, and individual family service plans, so early child special ed, school age special ed, we have to have a definition of TBI to make a student eligible. So this is important, and I've got some interesting news to share with you after I read this. So here is our definition to make a child eligible for TBI for an IEP or an IFSP currently in the state of Oregon. TBI is an acquired injury to the brain caused by an external force resulting in total or partial functional disability, psychosocial impairment, or both, that adversely affects a child's educational performance. The term includes open or closed head injuries resulting in impairments in one or both areas, including cognition, language, memory, attention, information processing, communication, and speech. It does not include brain injuries that are congenital, degenerative, or brain injuries caused by birth trauma. Right now, at this very second, in the Oregon Senate, there is a vote happening which will expand this definition of brain injury to include acquired brain injury. And I hope and pray it goes through, because here's the problem, folks. In the entire state of Oregon, age 3 through 21, we only have 338 kids that have an eligibility of TBI. And if you go back to my previous slide, there's no way that's accurate. And our kids are underrepresented, and they're missing out on services and appropriate interventions in school. So I'll talk more about that. So I really hope that passes. So I just talked about what a TBI was, the bump, blow, or the jolt to the head. Now, ABI, internal forces like hypoxia, lack of oxygen to the brain, toxins, fentanyl overdose, things like that, pressure from a tumor, surgeries, seizures at all. You can make a student TBI eligible. So remarkable and similar adverse effects in the cognitive realm. We have attention problems, working memory, processing speed, that EF, oh my gosh, executive function, and that new learning. And the biggie here that we just, when we miss out on a kid that is TBI, we say they're just a bad kid, behavior problems. Well, gee whiz, if we go back in time, we can probably see that there was a TBI, which has mood swings, irritability, anxiety, depression, impulsivity, and sometimes, folks, suicidal ideation. So just really got to be on the lookout for that. And then their social skills are impacted, sensory issues, that noise and light sensitivity, overstimulation, especially after our concussions. And we always talk about a TBI being that invisible disability, but we need to make it visible. And they can be long-term and very involving demands and effects and challenges for our students. So we've got to get this right. We know that falls, our understanding was that those terms were federal definitions. We need to do that in North Dakota. Yes, yeah. Okay,
Yeah. So am
yeah.
I not right on that? Because we've kind of not, I didn't realize we could approach state legislators about changing the definition because we see
Yeah.
the same thing that you said, way skewed numbers as far as IEPs here, served for TBI.
Oh, yeah. And I've done many presentations in Oregon, and the number for other health impaired,
Yes,
14,600.
exactly. Yep. Ours end up OHI. Yep. That's exactly what we see here too.
And so when I
Yep.
gave testimony to the Senate, it's like, well, this is not a dumping ground for our kids. We've got to get this right. And for many reasons, yes. You can't expand IDA definition. You
Oh,
can't do it.
okay. Thank you, Amy. That, okay. Cool.
If
Okay.
you make, if you, make some legislation for it, but yes, you need to make legislation for that. Okay. So epidemiology, falls, motor vehicle crashes, assaults are the most common. So which is why I work in Texas. Toyota approached us and said, could you please come to the great state of Texas and help us set up a program like you have in Oregon? Because we know that many motor vehicle crashes cause a brain injury. So that is why we're there. Falls and assaults, 20% of brain injuries are caused by sports-related issues, with certainly adolescents being higher. 10% of sports concussions involve a loss of consciousness. I played soccer from the age of 3 through 21. I know I sustained 2 concussions. Both times I did not lose consciousness, but I certainly had symptoms of a concussion after my second, and I'll talk about that more later. But your risk of TBI is 4 to 6 times greater after one and 8 times greater after two. So when we have our athletes that are having many concussions, there needs to be some very uncomfortable conversations between parents, medical professionals. Okay. I think of like Rod Gronkowski from the New York Patriots. He sustained 23 concussions in his career. Ouch. What does that do to a brain? Now, I am not against contact sports. I played soccer. I love football. I'm a big football fan. I am against folks that come back to play a sport when their brain is not healed. You're playing Russian roulette with your body. Okay. So that is my stance on that. So we know that our early our littles are very high risk of brain injury, secondary to fall, shaken baby abuse, motor delays. Then our elementary kiddos, a little bit lower risk level. Middle school, it increases. And then high school, it's a higher, secondary to the motor vehicle crashes, contact sports, risk taking. And boys are 2 to 1 times greater to sustain a brain injury. So there's your stats from CDC. So I work with a lot of school teams, as I said, and we're always trying to ferret out how is pediatric TBI different from other pediatric disabilities, okay? So if I'm a speech path. So if you think about a speech and language impairment, you see slight delays, a child ages, the task increases, the complexity of a task increases, and then you really see that impairment come out. But with a TBI, there's a sudden occurrence of a disability. Usually, it was unexpected. Usually, the person was unprepared. Usually, and there was nothing the person could have done to prevent it from happening. It's like boom, here we are in this world of brain injury, and it's scary. It's surreal, and parents and students and teachers sometimes are baffled by it. So. Our parents have a sudden ongoing need for medical professionals. They might need to take time off work. There's travel expenses that they weren't anticipating, sudden disruption of the normal brain development, sudden loss of peer relationships, possibly, lack of self awareness of who they are now, and more extreme discrepancies between abilities and uneven and unpredictable progress. And we'll talk about that later. We must get the most appropriate eligibility. So we have cognitive red flags secondary to a brain injury. Now, there might be lack of paying attention, staying on task. Now, think about any teenager, but then you tack on a brain injury, right? All right. Slow to response or processing of information, shifting attention. And oh, my high schoolers talk about this all the time, organizational challenges. So we need to give our students a lot of grace depending upon the day and the class, the time of the year. What do they need to get organized in the class? Because we know if our kids get overburdened with assignments, missing assignments, getting started on a task, what's going to happen? They're not going to turn them in and failing classes. So what do we need to do for our students? We might see reduced academic performance and certainly increased confusion. There's the social red flags, and this is a biggie because we know that there's a lack of mental health services nationwide, and it's pretty scary. With our students after a concussion, they have a lot of impulsive behaviors. They could have trouble starting conversations or activities, changes in mood. Yeah, this bad thing has happened to me and I don't get it. So they might have some withdrawal, depression, defiance, confusion, decreased motivation, and then anxiety. If you're a student athlete and you need to do daily doubles, plus homework and attend class, symptoms are worsened by that mental effort, environmental stimulation, emotional stress, and physical activity. There's also my students complain, my high schoolers after concussion. And I'm speaking a lot about concussion today, that mild TBI, but I certainly want to hone in on moderate to severe later on. But we have sleep issues. Sleep hygiene is a big thing for our kiddos. We want to get that figured out right away. Get that REM, get to sleep and stay asleep and not napping at 2 o'clock or leaving school to go take a nap. We've got to get that sleep figured out right away. The mood, so we've got to get the mental health services wrapped around those kiddos. And then my high schoolers talk about debilitating headaches all of the time. So we want to make those referrals out to our neurologists and get those figured out, because how in the world can you concentrate if you haven't slept and you have a headache that is a 15 on a scale of 1 to 10? It's very scary. There's also social issues. After my second concussion, I had some very serious vestibular issues like balance. So I remember getting out of the shower. It's like, whoa, what am I doing here? And I remember my mom picked me up, and this was in high school. Obviously, my mom picked me up after school one day, and I was in the back seat. My brother was in the front seat, and I had to pull over because I was car sick. Just the vestibular issues that came out of nowhere, and those symptoms hung on for probably 6 weeks. The vestibular issues. So. But I just really want to emphasize this too when you're out there on your teams, or if you're survivors or working with any of our agencies, social support of the family is the best predictor of function and quality of life after a brain injury. We just need to just wrap around that family and help them. This is nothing you asked for. And I always say sustaining a brain injury is like going on a trip that you don't want to go on. Okay. But here we are, and we got to make the best of it. We got to get through this. So sometimes our students are hesitant to seek out help for issues. So we created this really cool, and this is hyperlink, folks, and it's in my slides here, obviously. Go ahead and click on that. Online treatment and recovery assistance for concussion in kids, and it's for our adolescents. So they can go on it, and it just is a nice little infomercial about what are typical symptoms, how you can get past them, how you can help your sleep, etc. So we're really quite proud of that module. Okay, so I've spent the lion's share of 2025 working on legislation in the state of Oregon, and I'm very proud of what we're doing, because change, our voices must be heard. And I always say when I the guest lecture to universities, which I do a great deal of the time, I guest lecture to anybody that allow me to. Listen, you need to pay attention to these House bills, these Senate bills, your local politics, your state, and your country, because if you don't, someone else will make decisions for you. So I feel very passionate about that. So this young man, his name is Max. He was a star quarterback in Walport, Oregon, on the beautiful Oregon coast. He was a 4.0 student. He was a senior in this picture. He had a full ride scholarship waiting for him to go to Cornell University, where he planned to study journalism. He was the quarterback, and he sustained a hit in a game in 2001. It was quite significant. After that hit, he wobbled and had that ataxic gait, which is a telltale symptom of concussion, one of them, one of the many. He walked over to the opposing team's huddle, and his buddies came over and grabbed him. He was not removed from the game. He continued to play the game. He went home that week and complained to his parents of headaches, balance issues, light and noise sensitivity. Did not go seek medical care back in 2021, sometime, or 2001. That was not a law. The following Friday night, he came out, sustained another hit, collapsed at halftime, sustained a brain bleed. He had 3 surgeries, and his life is forever changed. Max now lives in a group home. Some years ago, I heard his father say, "That night my son died, and another human inhabited his body, and that human had the cognitive skills of a 9-year-old." Incredibly sad. This was preventable. This is why Max's father, Ralph, got together with Siebert, and we helped enact Max's Law. It's an OAR, Oregon Administrative Rule, and it requires Oregon school districts to implement concussion management guidelines for student athletes and coaching staff. You do not get out into the field until you've signed off on your training. So that law is hyperlinked here if you want to take a peek at it as well. So very, very sad story. So this is a return to play law that we passed in 2010. This is Jenna. And if you've ever heard of Bend, Oregon, try to make a trip out there. It is an outdoor person's wonderland. She was a skier from the Bend, Oregon area, and from the youngest of ages she skied. Holding in her hand here is a U.S. gold medal in ski racing. That was her ticket to the Sochi Olympics. Here's the problem. She didn't get to go to the Olympics because she sustained 11 concussions, and she was later diagnosed with persisting concussion symptoms, which did not abate over time, and she still has challenges with. And I should have said Max Conrad the previous slide. His condition was called second impact syndrome. He did not heal from the first concussion, sustained the second concussion, and it was devastating. So Jenna has persisting concussion symptoms. So we got with Jenna and her family and helped enact in 2014 a law called Jenna's Law, requires Oregon non-school sports and officiating of organizations to implement concussion management guidelines for all teams that include children 17 years of age and younger. So those are your Saturday sports, so your soccer. I know in North Dakota, there's loads of basketball. So any of those rec leagues. So, and again, hyperlinked here is Jenna's Law. In 2023, I did a webinar with Jenna, and during that, she talked about her challenges, and she divulged that she had considered suicide in the past, secondary to the pain in her head that would come and go, the debilitating headaches, and just the loss of her identity, who she was. Her executive functioning skills, short-term memory, working memory skills are very challenged. She's very lucky to be married to a wonderful man. Her parents live close to her. She has 2 small children. She cannot hold, she's chosen not to hold a full-time job. She's a mom. She and her husband are ranchers. When she puts her small children in the back seat of the car in their car seat, she takes her shoes off so that she doesn't forget that her children are in the back seat. So still struggles a lot and has a lot of devices in place to help her remember things. So again, this was preventable. What if Jenna would have sat out a season, a week, a month between those concussions? What would have happened? What could have happened? We don't know. All we know is that after one concussion, your risk is increased. So heal that brain. I'm not against contact sports, but heal that brain before you come back to play. Okay, so return to play laws. I'm going to move now. If there's any questions on RTP laws, just let me know in the chat. I'm going to move on to return to school laws now. Okay, so all 50 states have a return to play law that includes education for staff and athletes, removal from play, and return to play when you are medically cleared to do so. And it's very specific in our laws about who can clear an athlete to return to play. But only 13 states have a return to school law. I would love to see North Dakota get their own law in place. I'm currently working with Texas and Arkansas and California to get a return to school law. And I guest lectured to University of Southern California, a speech path class. And by golly, those SLPs are taking the charge and they're doing it and going to the Capitol. So it's fun to watch. So it's exciting to see young people take charge and be involved in changing legislation that affects a lot of children. So if I can ever help North Dakota, we also have an attorney on our staff Happy to help. So, 13 states have a return to school law. How does that look? So, when a student sustains a concussion, otherwise known as a mild TBI, they go to a medical provider, they're given the diagnosis. Possibly that medical provider will send back a note to schools with accommodations that they suggest to help that student return to school and be successful. Um, that is what a return to school law is all about because we know our athletes come back. Most concussions abate the symptoms within 6 weeks. Okay. What can happen in 6 weeks, though? A lot. So, our goal with the return to school law is not to let a temporary injury, like a concussion, alter or impact the trajectory of a student's life. This is my boss's daughter right here. Her name is Lily. Prior to our law passing, Lily was a star soccer player. She sustained 2 concussions, her last one in her junior year, which she had a lot of symptoms. Lily had vestibular issues like me, balance, light sensitivity, noise sensitivity. She fell behind in school with assignments. She had a hard time sitting in classes with those fluorescent lights. Her mom came to the school and said, please, please, can we, for the next few weeks, implement a couple of accommodations to help my student, my child, be successful? And just knowing that I'm going to be with her, working hard with her as well. She doesn't get a pass to do nothing. Okay. So what did they do for Lily? She was allowed to take tests in a quiet room with a familiar adult, lessened assignments for 6 weeks only. I think they let her wear sunglasses or a hoodie in class too. So had that not, her grades dropped from a 3.5 to a 2.0, which is why Mama Bear got involved. Now think about what you're doing in your junior year, right? You're looking for colleges. And that's all Lily wanted to do was to play collegiate soccer and be in business in sports marketing someday. So this all worked for Lily. She recovered from her concussion. She graduated from Western Oregon University a year and a half ago. She played semi-pro soccer for a bit, and now she's in Minneapolis working for a sports marketing company and making more than her mother and I put together. So this all worked out. It's a lovely story. But here's the thing, folks. I could sit here for 3 hours and tell you stories of students for which this did not work, and they dropped out. They spiraled into a life of crime and or drugs and alcohol to self-medicate. So very sad. So this is why I'm so very passionate about return to school. I was that student athlete, okay? And I know how that felt, and I struggled to get through. So our law that we passed in 2021, House Bill 4140, mandates an immediate temporary accommodations plan. So what does that mean? When a student has a documented brain injury, we fill out an accommodations plan. So I'm just going to give you some examples of them, okay? This is one Oregon Department of Ed created for us. We don't really like it because it's too long, but you see their specific accommodations. So as a team, you come together. So doctor gives you the note, says, please use these accommodations. You assemble the team within your building or your district or your district. You decide on student accommodations. As a team, share this with your staff. When I worked in the schools, I would make a PDF of this and send it to all staff working with that child and say, please make sure that these accommodations are being followed, okay? Here's another one that our friends in the Portland area created. You may use these in North Dakota, okay, if you like. Here's another one that our friends in the Bend area created. And this is from the Oregon School Activities Association. So our ATs are involved in these. Our athletic trainers are involved in these plans as well. So I'm going to speak to more of this. So as of yesterday, this House bill was passed in Oregon, and we're so excited. The previous House bill was a building may implement immediate accommodations plan. So I had administrators saying to me, the word is may, I don't have to do it. You can't make me. It's like, and why on earth wouldn't you want to do what's best for kids? If a student rolled into your high school with a broken leg, you wouldn't say, suck it up, junior, figure out how you're going to get up and down into your classes, right? You're going to give them help. How about a brain? So, as of yesterday, this House bill passed that mandates that school districts must, Okay, so it ensures mandatory academic, behavioral, and social emotional accommodations for concussed students, requires immediate removal from activities that pose a risk for re-injury. So sometimes they may not be able to go to PE at all or recess. So we got to work with the family and the district on how that's going to work. Okay. So accommodations in place, a structured framework, and we want our kids to recover, resuming academic expectations. So we're giving you so in Oregon, I'm giving them all of those sample forms, and I want them to have autonomy. I don't want to come in and tell you what to do, but you need to follow this law. It's not a choice anymore. So make up your own template for an immediate temporary accommodations plan and use it. Okay. So parents must be notified. We want to determine and implement physical activity limitations, document their symptoms and challenges, identify and apply necessary accommodations in academic, social, and emotional support and behavior management, ensure clear communication with teachers, nurses, counselors, PE staff, coaches, and other school personnel. So everybody's abundantly aware of this ITAP. Okay. There's activity restrictions. Schools have 10 days to create and implement the ITAP. It must be reviewed at least every 2 months. And if accommodations are still needed 6 months post-injury, the student should be referred for a special ed eval or 504. That's at a building level. Do they need a 504? Or do we need to assess for specially designed instruction, otherwise known as an IEP? So I am so happy that this is in place. Sometimes I would come into buildings for meetings to help out staff, and we had kids on an ITAP for a year. Okay. No, 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 no. We need to figure this out. If it's a concussion, those symptoms should have been abating. If not, then we have persisting concussion symptoms and we need to go deeper. And again, what does our student need? Any questions on that? I know it's deep and heavy. Okay. Carly, in North Dakota, what do we do for our concussed students that need just temporary accommodations?
It varies greatly by district to district. There really isn't, I wouldn't say, a succinct plan. Morgan is on too, and she's with our Department of Ed. I don't know if Morgan, if you have an idea of what the actual plan is supposed to look like, but all of our coaches are trained on concussion management for sure.
Okay.
I like your idea of combining the athletes or having the athletes partake as well. But yeah, it's very different from district to district is what we've found so far in our work.
Okay. And folks, I don't want you to be freaked out by this. In my subsequent slides, I'm going to talk about how easy this can be, even if you're in a rural area. Okay. All right. So why are our kids with TBI underidentified and underserved? And after 29 years of working in the schools, I got lots of stories. Okay. A lot of the times our kids are not picked up because they're older injuries. They fell out of a high chair when they were a toddler. Sometimes they were in foster care and were abused, and this was not reported. We have some families without good medical care or families that do not choose to take their child to see a medical professional after an injury. That happens. This is an article that I found in 2020, and I tell it all the time because it's very disturbing. In this study, the prevalence of TBI in foster participants was 65%. Neurotrauma reports. Okay. So we know those kids are out there. We need to find them. We need to be asking the hard questions. Okay. Scary stuff. And again, I'm going to say this again, the invisible disability with a child with a TBI, but we want to make that invisible visible. Our kids usually come back to school after sustaining a concussion, mild brain injury, and they look the same, but they have inconsistent learning profiles. And we know that the first 6 months after the injury, the improvement can be dramatic, and then it might not be. It might plateau. It might be just a little. If you've seen one brain injury, you've seen one brain injury, okay? They're vastly, vastly different. The effects of TBI are subtle and confusing. For example, a 7-year-old may seem fine post-injury, but struggle at age 12 when higher level planning demands emerge. Okay, and those are the times that I would get the phone calls. What did you guys do on the elementary level? This kid is struggling. So there's a lack of awareness of TBI. It's considered a low incidence disability. And then there's that myth that kids just bounce back. Well, they don't. They tell this to teams. You open yourself up to liability if you know in your heart that that child has sustained a brain injury, yet decide to place the child in another category because it's easier. If your school team suspects a brain injury, the team is obligated to assess in all areas of disability to meet the child find requirement. I am always, always, always open to trainings. I've written thousands of IEPs. At one point in my career, I was also the 504 coordinator for 7 years. So I've written hundreds of 504s. I'm happy to help. Okay. Just ask. Okay. These are the forgotten injuries, right? Impact might not be seen till later. Think about our students in elementary. You do multi-tiered systems of supports in North Dakota, right? Or something of that nature. Or RTI, response to intervention.
Yes.
Okay. So we have these RTI meetings every couple of weeks about our kids. We're looking at their scores. And then in elementary, changing the way we do business, changing our curriculum, changing accommodations. This is what we do. When those kids go to middle school, they might be stuck in a class with 35 kids with very few accommodations. And that's when the rubber hits the road. And as said in a previous slide, yikes, this is where we see challenges rear their ugly heads in full force. Okay. There also can be a communication breakdown when a student has been in a hospital, then is returning to school. Um, Sometimes it's very difficult to get reports from certain medical facilities, which is very frustrating to all. And parents usually bear the responsibility to educate the school personnel about the effects. And there's lack of communication. If you think about our kids with the high mobility, they move from school to school to school, that TBI could get lost over time if it's not adequately documented as well. So that's why I say bring together your communities and everybody keep talking. Everybody keep talking. We call it a liaison in our biggest hospital in Portland, Oregon Health Sciences University. When one of our students in the neurology department is discharged, I'll get an email. Melanie, this kid is coming back to Klamath Falls, Oregon. So I get my team enacted quickly and get that report. Our liaison signs the request of information forms to sign so we can exchange information, quickly get those reports and get that kid back to school the first day with the help they need, especially if nursing is involved. Okay. We can't let a kid come back to school if there's meds and at all. So that good communication between hospital and school, easier said than done. Okay. So if you think about trauma, I'm going to kind of blaze through this because I'm a speech path and I talk a lot, I know. Think about trauma though, that first word in traumatic brain injury. The feelings are intense. They're unpredictable. They might have recurring emotional triggers, the anniversary of the event. Okay. There's more conflict and frequent arguments with families. Think about if you've ever went through some trauma, right? And then little things pop up. Well, yeah, you're going to get chest pain, maybe high blood pressure at all. So, I'm going to tell you just a really quick story. One of my students, I'll call Vinny. He was in the back seat of a car. Dad was driving the car. Mom was in the passenger seat. Vinny was in the back seat. They were hit by a semi. Vinny's father was killed in the accident. Mom sustained many injuries, and Vinny went through the front windshield. Vinny doesn't care if he ever gets into another car ever again in his life. He does not want his driver's license and has just a lot of PTSD from that experience. So tack on PTSD with the injuries that he had from having a moderate brain injury. And we've got some challenges. And I'm going to let you read these on your own. Things that kids have said to me over the years. I thought I was going to die. They cut off my clothes, et al. It happened so quickly. Um, Okay, so just know that our kids, we need to wrap around them after this traumatic thing, especially if it's abuse or it's in a car collision at all. We've got to address that social emotional piece as well. I can't say that enough, okay? And some days are going to be good, some days might not be so good. So let's just be cognizant of that, okay? I'm thinking of a time that I was in high school and well, I'm going to go this example. I was working at a school in Springfield, Oregon, and one of the first school shootings that happened. Somebody thought it was a good idea to wheel TVs into the school library while kids were checking out their books and showing all these kids running out of the school for this Thurston High School shooting. And now when I look back, it's like, that's the craziest thing we ever did. Then the bell rang and we said, kids, go back to class now, okay? And try to concentrate. That was nuts. What were we thinking, right? And I was there too, and I didn't stop it. So that trauma, just understanding what our kids have seen. You can't unsee some of this stuff, right? But we got to deal with it. Can't say that enough. Okay, so I know we have a school psych on here. Um, I want to talk about evaluating for a brain injury. I'm going to go through it kind of quick, and then I'm going to go into concussion management teams. Please take a biological break if you need. So, this is what a school psych sent to me some time ago. I'm working with a student who's on a 504 plan, and we're now considering evaluation to move her into a special ed eligibility under other health impaired. Does the eligibility category really matter? So much testing is required for the TBI eligibility. Although I'm more than happy to conduct an extensive eval, I'm wondering if there are any real long-term benefits or differences between these eligibilities. Okay. Hyperlinked is his question to me. Okay. TBI eligibility provides better protection for that student. Okay. It documents the injury. It makes sure it's not forgotten as the years pass, especially if new problems are related to the brain injury arise as the student ages. And I tell folks, when you're writing your IEPs or your 504s, make a statement. Brain injury occurred what year? Where are we right now in terms of symptoms for this student? Make sure that is clearly listed in your present level of performance. And how has that changed over time? And again, you're obligated to assess in all areas of the disability. And again, if that child moves and is other health impaired, what does that tell us, right? In subsequent slides, I'm going to tell you about other services that are available for a student. The big thing now, sometimes we can't get the medical statement for a student who has sustained a brain injury. It's difficult, especially think back to COVID. And in times when I worked in the schools, I remember one time I got back this medical statement. It said TBI 2017. What does that tell you? Nothing. So we got a new bill, which became a law called the Guided Credible History Revision. This is in the case where we can't get a medical documentation or the person did not seek medical attention. So what we do, interviewer, it's an interview. And I always say go in pairs. So the school psych and I would go, or the counselor and I, we would interview the parent or the caregiver who's familiar with the acute and latent symptoms and nail down pre-injury versus post-injury functioning. I like this better, especially if you get a spotty medical report back. So you're asking the where did this happen, when, and how? Are the answers medically plausible? On our website, returntoschool.org, I have a school psych report template for TBI with that guided credible history template in there. All you need to do is go cut and paste that. If you want to go down that road, it's not a law in North Dakota, but possibly you could do that. Okay. I've also got a school psych report up, and you'll see it in a minute here. On our website without the guided credible history in. So you can just copy and paste that, put in your scores. It's pretty slick. So what do we need for a TBI evaluation when your team comes together, your multidisciplinary team? We need that medical exam, or in Oregon, guided credible history interview, psych assessment, developmental history. Please, please, please do a comprehensive developmental history. I want to know what happened to that child from the time they were born till the present day. Were they stuck in the birth canal? What were their APGARs? If you can get that figured out. What were their developmental milestones like? Did they have a high fever? Did they fall out of a high chair? Things like that. We gotta know that. I can't tell you how many times we went back in history with parents. And they said, "Oh yeah, like one of my students, yeah, he fell off the trampoline during COVID, and he fractured his temporal bone in his skull, had bleeding on the brain, but the doctor said he was okay." Okay, come third grade, we figured out that he wasn't okay. All right. So developmental history is so very important. I know that every district has their own. Other information relating to the child's suspected disability, observations. So I always like to do one in a structured environment like reading class, math, and then I would like to do one in an unstructured environment like PE or library. Can they follow instructions in a noisy environment? How does that look? Okay. And then additional assessments necessary to determine the impact or any other additional assessments like a hearing test et al. Okay. Thank you, Carly, for putting that in the chat. Returntoschool.org. So hyperlinked are some standardized tools that you can use for your assessment observations. There's sample observations on our website, and that again is hyperlinked. So just in summary for TBI eligibility for special ed, Okay, difficulties, these are difficulties secondary to acute event, specifically brain injury. There's changes from the previous event. Abilities and needs change with the recovery process, okay? And needs and interventions are not limited to a single area. They tend to be across all settings. And our accommodations on their IEPs or a 504 should state something like needs frequent checks for comprehension, extended time on assessments if they need it within reason. Our kids don't get a pass just to do nothing, right? And we don't want to set that precedent, but just really take a look at that student. What do they need today? Frequent assessments that are flexible. We call it MTSS, you call it RTI, that's all good. But our assessments must be frequent and flexible and sensitive to uneven progress patterns. Okay. So I always love looking at our curriculum-based measures. Okay. So when we tack on other health impaired eligibility on a student, here's the things that can go sideways. So when I worked in the schools and I would have a kid with a TBI or an ID, intellectual disability, we were eligible for our kids. We're called the Lane County where I live, disability services. These are wraparound services that our kids can access. So my boy that cracked his temporal bone on the trampoline, we made him TBI. His family was eligible for after-school care that was paid for. He got summer camp tuition scholarships paid for. He got ride source paid to go back and forth to Portland. We're 2 hours from Portland. That was paid for by disability services. And mom got respite care. She was a single mom. Every second Friday from 5 to 8. And you've never seen a happier mom than a Friday night from 5 to 8. She was so happy for a break. Now, we did right by this student by making that child TBI because he truly did have a TBI. Um, do you see other health impaired on this list? So that could have hindered that child from getting services. Okay. So just think about that. And also our disability determination services are otherwise known as SSI. If there's a TBI listed, they have a good chance of getting those services. And all those wraparound services in our states and in our at the federal level that student could be eligible to are lost over time. I also see some of my kids when they go on to community colleges or college, they're not able to access the disability centers. Okay. So let's do right by our students, get them the eligibility they need, give them the interventions they need, the accommodations, and let's get them onto a happy path in life. Here's a sample school psych report, as I mentioned before. Here's a sample SLP evaluation report, too. So again, go in, cut and paste it, make it work for you. Okay? Here's a sample 504 IEP accommodations and modifications for a student with a TBI. It's hyperlinked here. So sometimes, with our younger professionals too, they sit down like, where do we start? Okay, let's take a look at this list. What works now? And let's put them onto the IEP, knowing full well that we can always edit or revise an IEP or 504 or an accommodations plan. Okay. Here's some sample IEP goals for a student with a TBI. There's loads of them. This is just as much as I could screenshot. So there's reading, writing, math, self-awareness, executive functioning. So in summation, we want to create a supportive classroom environment. Talk to our kids about what's contributing to flare-ups. Is it noise? Is it light sensitivity? What is it? Evaluate the environment for potential triggers. Are they sitting next to somebody they shouldn't be sitting next to? Let's move them, okay? Always that positive reinforcement for our students. They get enough negative in the world. Access to school counselors and psychs, social skills training, and support that family unit. So in special ed, we love our triangles, right? So tier one, this is what we do for all of our kids in school, okay? We have multidisciplinary teams, common classroom adjustments, slight environmental modifications, and we know that our kids with the concussion likely will recover quickly within a month. But maybe they don't. So we get down to tier two. We have more targeted group interventions, maybe a 504 plan, academic accommodations, environmental modifications, and our kids still might recover. But then here's our tier three. So individual student interventions, significant environmental modifications, curricular modifications, special ed, and extended recovery time. So these are some of the statements from school staff in the past that they've said to me. And I try to be very professional and keep a straight face and not get angry. But these are the misconceptions that we need to be out there sharing with staff that, okay, why is she acting like that? It has nothing to do with their brain. They're just lazy. He looks fine. He should be able to get back in class and on the field or the mat. I don't understand why she's taken so long to recover. They simply have no motivation to do their work. You used to be able to do your work on time. I don't see why you can't now. Really, the student barely bumped his head. How does he have another concussion? These are all teaching moments, folks, with our school. And like I said, you know what you know, you don't know what you don't know. And that's our job, to get into the schools and in our communities and just help with those misconceptions. So, concussion management teams, no matter if you live in Beulah, Grand Forks, or Minot, you can establish a concussion management team. It's a little bit of heavy lifting. But once you have it established, you are set and you are ready when a student returns to school after sustaining a brain injury. Now, I know that in some of our rural environments, you don't have a physical therapist, an occupational therapist. You might have a virtual speech path. You might not have a counselor, but you do have an admin, and you might have a nurse, but you do have teachers. You might have a virtual school site too, but assemble a team of folks that can get together and meet on a regular basis, even if it's for 10 minutes, that are notified after the injury. They help come up with temporary accommodations, and they take the provider-based accommodations into heart. They monitor and review that kid's case, provide resources for staff, similar to the bullets, the speaking balloons that I just showed you, just resources to staff and streamline communications. When I worked at Springfield High School in Oregon, we would meet every second Friday from 7:50 to 8:05, 15 minutes. I had a Google Doc that I made, and I have hyperlinked a blank form for you. See, concussion management team, or in Texas, we call it a brain injury educational support form. Go ahead, edit that, make it work for you. But track those kids. So what we don't want to happen is a student falls off the monkey bars in September, sustains a concussion. We fill out a medical report, stick it in a Q file, and then we might forget about it. And then come May, something else happens, and we've forgotten about the first one. We need to track that for obvious reasons. So I always say, for the life that the student is in a school, have some kind of a tracking form like this, tracking what's going on. So in this case, this is at my high school, and I made up these names, certainly. Okay, this is John. That was the date of his injury. We have a doctor's note. You better have a request of information from that doctor. And we want to know the student's counselor, because that counselor in that school really took the lead on this concussion management team. Okay. John was an athlete. He's on one of those immediate temporary accommodations plans, secondary to concussion. Right now, at the time we met, he had 2 missing assignments in chemistry. We want to figure that out right away. He also has 6 tardies. We want to figure that out. Is he on any other meds? Is he seeing a physical therapist for vestibular therapy? Any mental health services? Okay. We want to know that. And these are in subsequent columns. Cynthia, she is not an athlete. She's on a 504 plan, 1 missing assignment in biology. She has 23 attendance concerns in springtime. We need to get to the bottom of that. Is it due to headaches? Is she not doing well in the morning? So in the morning, first thing, one of her classes could be study skills. Let's make it easy on her, right? If your seat is not in a seat, you cannot learn. Okay. So if that student is in your school, I mean, I get with the online schools, but 23 attendance concerns is very scary. This is Alan. He's an athlete. He's on an IEP, 6 missing assignments, and 5 attendance concerns. So tracking the student for the life they're in. After these 3 graduate, you can start a new form, but let's track these kids over time. Okay. Go ahead and put those questions in the chat. I always say on your concussion management team, you need to have your admin on your side. If the admin does not believe in a concussion management team, you're fighting a losing battle, okay? Because that admin ensures that district policies and laws are being followed by the staff. Not very often, but sometimes I would have teachers on our team come up and say, that kid doesn't need it, they're just working you. Okay, well, no, they're not. We've got this plan in place for very good reasons, okay? But we also, that admin communicates with staff, students, and parents. Your school site might be asked to collaborate on building teams to develop appropriate accommodations, interventions, attend and provide input at meetings, collaborate with teams, attend concussion management teams as able, and then evaluate. Same for an SLP, right? Evaluate for the appropriate eligibility. I'm going to skip over this case because in the interest of time, again, creating those connections in your communities. I may go back to it, but creating those community connections in your communities. Get to know your local physicians, even in your little towns, okay? Your ER rooms, urgent care, sports rehab centers, okay? In my county, I established a concussion management team with my medical professions. So every second month, I meet with a neurologist, a sports medicine specialist, neuropsychologist, and a psychologist that specializes in TBI in adolescents. And we meet when we have information requests to exchange information with parents and schools. We talk about what the kid says at the medical side versus the educational side. What can we do to help? And that's where you get your quick referrals out to neurologists and vestibular therapy at all. So I can't say that enough. Everybody keep talking. So you think about care. The first 2 weeks after a brain injury, we're doing that medical exam. We're doing a risk assessment. We're going to activate our concussion management team very quickly. We are talking to our physician, getting those papers signed, request of information. We're early managing it quickly. We want to determine symptom tracking that includes cognitive and evaluations at sleep hygiene, headache, and behavior, temporary accommodations plan. Maybe they need vestibular or vision therapy, medication changes the first 2 to 8 weeks. And that's, again, concussions usually abate within 4 to 6 weeks. If they don't, then we need to seek out other care. Maybe we need cognitive rehab, okay? Treatment for chronic pain and headaches, psychotherapy, 504 plan and IEP, right? And just follow up every 2 weeks with the goal of prevention of brain injuries. Okay, any questions so far? You're a quiet bunch. Okay, when you talked earlier about the hospital, when there's a TB, how do you work around HIPAA and FERPA? Once we know about a case, we can get a releases in place. The hard part sometimes is that first contact. You're right. Um, request of information with doctors. It's in Oregon, in my teams, it's easy because we have those established forms. And Carly, go ahead and jump in anytime if you think about this, how that works in North Dakota. Notify school when there's a TBI. Okay, so Amy, in this case, we have that liaison that talks to the parents and says, please sign this form. Request of information with Center on Brain Injury Research and Training so we can all talk. The hospital, Siebert, and the parent. Then we go back to the school and we say, can we get a release of information with you? So all of us can talk together. So yes, there's a whole bunch of forms to sign, but that gets around the HIPAA and FERPA. And if you don't have those forms, folks, we're in trouble. We know that. Carly, did you want to weigh in on that? Are you good with that answer?
I'm great with that answer because yeah, we struggle just as much as you do, Amy. That's the big part is we're trying to get the buy-in from our bigger hospitals to provide that release and to let us know when there is someone, but it just so far hasn't quite happened that way yet.
Yeah. And this is an anomaly, right? This is the only hospital in Oregon where this happens. Thankfully, it's the biggest hospital where the most severe brain injuries occur. So yeah, there's a whole stack of Siebert's requests of information sitting there. He has it on his computer. He can print it off. We sign it. We upload it. Boom. Okay. So it happens before when they're having the discharge meetings. That's when this form is signed. They agree on the last day in the hospital, the discharge date. Then I get into the equation. We get forms signed with the school, and then we can quickly determine the first day back to school. Okay. So yeah, is it perfect? Oh no, oh no. But we're working on it, right? Okay, here's a study that I want you to be really aware because I'm proud of it and I'm sad with what I'm hearing. We are partnering with the state of Alaska, 2 counties in Oregon. Okay, we are determining if justice involved youth with TBI, how significant this is. So we developed a 5-question screener when kids come into detention. They're arrested. They come into juvenile detention. They fill out the screener. Here's how it looks. In your life, have you ever been hit on the head or have any scars as a result of that injury? Like especially in North Dakota, snow machine crash, fight, sports, being slapped at all. In your life, have you ever been knocked out or dazed or confused after you were hit? Question number 2. Number 3, have you ever been very sick or badly hurt? This is where your ABI comes in. Brain tumor, stroke, seizures, or near drowning, car crash, bike wreck, big fall, stop breathing, or poisoning. Number 4, after you hit your head or were very sick or badly hurt, did you have problems that you didn't have before, like headaches, trouble focusing, trouble sleeping? If they answer yes to number 4 and they denote specific symptoms, this is called a positive screener. Now, does anybody want to take a stab at what percentage of kids answered yes to 4 and 5 and were very positive in the state of Oregon? You want to take a crack at it? Can somebody please? What percentage of the kids do you think tested positive for a brain injury in detention? More than half, 60%.
Yeah,
Thank you.
I'm gonna go 90%.
90, 86. Thank you for jumping in. Okay. Anybody else? It's a very sad study. Okay. I'm sad that I'm seeing the results I'm seeing in the study, but yet I know that we're finding out information for which will help kids. So in my county, it's currently 25%. In Southern Oregon, it's 17%. In Alaska, 60. And yeah. So what do we do with these screeners when we get them? So the kid gets out of detention. There's a school in detention, of course. That screener goes back to the school where the kid is, and they can, if the kid's not on an IEP or a 504, then we quickly get them what they need, i.e. an evaluation, or get them on an accommodations plan till we can figure out what's going on. The problem is right now, and you know this, attendance is harsh. Sometimes kids are in and out of detention or juvenile jail facilities, and they've been called frequent flyers. They're in and out and on the streets and doing drugs, and it's a sad story. But I just think, yes, it feels some days like it's a drop in the ocean, but by golly, it's making a difference, and we are finding kids. So stay tuned. We're done this study at the end of June, and we'll be writing up this paper. We do a lot of research. So if you go to our website and read Research Matters, it's a one pager on a research. You don't have to go through all 25 pages. So take a peek at that. We also started a podcast series, and a lot of these were from our friends in Texas. So one of them is a nice Midwestern boy, Ben Utek from Minnesota. He won the Super Bowl when he played for the Indianapolis Colts. He still lives in Minnesota now. He talked about the 5 concussions he sustained playing pro football, and then he had to retire, and he wrote a book about it. So give that a listen. This one was, where's that one? Shaken Baby Alliance from Fort Worth. That one was really disturbing. I had to stop during that and take a break. Ooh, who shakes a baby? And in this case, the woman that started this organization, her brother-in-law had taken a baseball bat to her infant niece. And I thought, who does that? And she said, when I get through this, I'm going to start something that will help many other children. Hence the Shaken Baby Alliance, which helps kids all over the country. So, here's another one. Markel Taylor was in People magazine in September. He was in a car accident at the age of 9. He was stitched up and sent home, sustained multiple concussions secondary to an abusive home, and plunged into a spiral of in and out of juvenile jails and in the adult system. While he was sitting in Denver in a jail waiting to be sentenced for kidnapping and armed robbery, Dr. Kimberly Gorgans, University of Denver, came in with a group of graduate students and did a screener with him and said, wow, 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 you've had a TBI. Let's get you some help. And he did get help after he had served while he was in jail, got out, and is now a big advocate for folks getting therapy, not just sitting in a jail cell. Okay. This is one of our students from Portland, who was from the youngest of ages, Jonathan Bolin, destined to be in the NFL, sustained a couple of concussions, and then he had to end his football career as a freshman in college, and then started to self-medicate secondary to headaches, vestibular issues, and committed 3 armed robberies and went to prison. And he found a wonderful psychologist in prison, got out, and is now also a big advocate for getting help for brain injuries. And he started a gym because guess what? He's got 3 felonies on his record now. And so he started his own gym called Breath of Life. And he's just a great resource, and he is a breath of life to talk to. So give our podcast a listen. We also have a monthly educational med seminar, we call it. So each month we alternate education and medical, education, medical. We speak for 30 minutes and then we take questions and answer heavy on the research component. So last month we had an athletic trainer from the University of New Mexico. This month we will have a speech path from The Ohio State, focusing on ABI. So give a listen to her. Click here to scan this to register. Once you scan that, it will be good for all of our EdMed seminars. We do the monthly. We're taking July off. Okay. We've got some international speakers that are wonderful. We have Angela Rothner is from Germany, and she will be with us in October. So here is our webinar series, and you'd be hard pressed to not let the North Dakota Speech and Hearing Association accept our webinars for credit. And we've got many great speakers on there, so take a listen to them. Go ahead and scan. You can certainly they're all completed for the year, but you can watch them online. When you complete the webinar, you will be given a certificate of completion, which you can upload to your governing body for PDUs. So my next round of webinars will be announced at the end of August, and we've got a great bunch coming up again. Here's our learn. These are some modules that you can learn about TBI. Here's our website. So if you go to tools, school psych, there's 4 items in there. Oh, and they are in Spanish. A lot of these are converted into Spanish. Speech language, you have 2 items. Our school nurses, 15, and I'm working real hard with our school nurses. Here's how our state is broken up to TBI teams, and I sure hope that North Dakota can do that. And I'm happy to help that, Carly, in the future, to help you set up teams. And again, doesn't matter. I grew up a town of 200. My husband giggles in Saskatchewan, 200 at Christmas time when there's a wedding and a funeral going on. But you can make this happen. I can show you how to do this, okay? Nothing is perfect. Many teams are functional. And if you have that drive and that passion to make it that way, it will happen, okay? Okay, thank you for your time. I'm going to stop sharing. You have my slides. What question do you have? And you can unmute yourself and just let her rip.
Yes, or type in the chat and I can read it for you too, either way.
And is there anybody from Minot on this call? I'm just curious.
You see a big knowledge difference between hospital and school by the providers?
Oh, John, that's a loaded question, John. You got a couple of days for that one? Um, I see sometimes medical providers will say for a mild concussion, this kid needs to be in an IEP when they clearly don't, because they don't understand. And that's why I keep speaking to medical professionals, and everybody keeps talking, right? Yes, yes. I don't think medical providers understand how hard it is to teach in a class of 35, i.e. at a medical or a middle school or a high school. They don't understand the standards that we need to teach to. And they're like, why is this kid failing a class? Come on, you're not a good teacher. I'm paraphrasing. I don't have medical professionals that say that to me. You're not a good teacher, but they question what we do because they don't understand, right?
So they think that outpatient is the route instead of in school?
Right. Outpatient is great, but that kid needs to graduate. So how are we going to work together to make that happen?
Right, right. That's what I
And
was.
yeah, and what tools did the speech path or the OT or the PT give that kid in outpatient that we can help with in schools? But if we don't know that information, we don't get those reports. That's a problem, right?
Mm-hmm.
Yeah, great question, John. Morgan, thanks for saying that. Planted numerous seeds. And here's the thing, folks, the U.S. Department of Ed is dismantling. We're all losing money, but what can we do with what we have, right? Okay. Anyone else? All right. I would love to come and chat in North Dakota. That'd be an excuse for me to get home to Saskatchewan anytime. So let me know if you have questions about how to establish those concussion management teams. I'm here for you. I've given you a lot of resources. Sometimes when people give me a slide deck and they say it's in a slide deck, it's like, no, get on a Zoom call with me, and I'm happy to problem solve that as well. Okay. All right.
I appreciate your time. Yes, we definitely, you got a lot of wheels turning for Morgan and I, so. Yeah,
Okay.
I hope, I'm sure for everyone else on the call too. I like Siebert's website and I like all your stuff, but I like how you pointed out like exactly where stuff is too, because you guys have so much. I'm like, I go there and I'm like, but it's good. It's good. So I'm glad
Oh,
you,
Chloe and I were chatting before we got on with everyone. We're writing a transition toolkit as well. So those
yes.
kids from age 21 to going out into the world that will be involved in voc rehab et al, right? So we're getting that together. That should be done by June. That'll be on our website. I'm also writing a concussion management technical assistance manual, similar to the one that Carly wrote, the educational toolkit,
Yes.
but it's a step by step by step, and that should be done by August 1st, and that'll be on our website as well. You're welcome to, it'll be an ebook. You're welcome to download that. And again, just know, yes, it's Oregon, but we're very similar in the things that we do.
Mhm.
Okay.
Yep.
Jane, thanks for saying that you learned a lot. I appreciate that.
Well,
Okay.
thank you.
All
Thank you for your
right.
time. I would like to say that it was a very good presentation and well prepared.
Oh, thank you, John. I appreciate that. All right. My heart is in North Dakota. I wish I lived a
Yes,
little
hopefully
closer.
we'll get to bring you in, bring you here soon. So
Okay.
we
All
love that.
right.
Okay,
Have a
thank you
great,
so much.
have a great
Bye,
summer, everyone. Bye.
everybody.